But again, that memory that holds information, when it's the right time for it to spark, it will present itself. And then our motor skills, how we move our hands, how we mobilize and manipulate objects. And then language, which is the next slide. Motor skills and language. All right. So in having that little understanding of what the brain consists of, what the brain does, I want you to go away with these two things. The brain essentially monitors our internal world, meaning it monitors everything that goes on the inside, our organs. It warns us as if any of the organs is malfunctioning, if something's wrong with the organ. It regulates our body temperatures. It regulates our heart, breathing rates, our sleep and wake cycles, and even our sweating. It regulates all of that. So a healthy brain allows us to optimally fulfill the demands of our life, minimizing the impact of brain disease and maintaining a restored function in the face of challenges. Next slide. Oh no, let's stay right here. So what are some of the medical conditions that impact the brain? Heart disease, diabetes is a main one, dementia and Alzheimer's, traumatic brain injury, which is what I shared earlier on, that when I had the parasite in my brain, that it did give some brain damage, and that brain damage affected part of my memory. Lifestyle factors, those lifestyle factors, which is like recreational drugs, affect the brain as well. Over-the-counter and prescription drugs, if it's abused, affects the brain. And then obesity also has an impact on the brain. Next slide. All right, so here, dementia and Alzheimer's. Actually, we can go back because I want to ask a question. Thank you so much. So, or you can actually take the slide down. All right, so my question to the community is, when you think or when you hear of dementia and Alzheimer's, what have you been told about the two? Are they different or are they the same? And if we can, come on in and let's share what we know. Admin, if you can select someone.
Hi.
Sure. I heard a voice.
It was Ariane.
Oh, okay. Sure, please share.
I think Alzheimer's is the umbrella term, and dementia falls under it.
Absolutely. Anyone else would like to share what they think Alzheimer's is and dementia? Are they the same or are they different?
So Charmaine, Terry put in the chat different, but both involve loss of memory. And Jacqueline also shared she was told they are different.
Yes, they are different. And what makes them different is Alzheimer's is a disease versus dementia is what you get from brain damage. You could get dementia from strokes. Like my cousin has had several mini strokes, and she unfortunately now has dementia. Like myself, who had a brain injury due to the illness that I have, I am a prime candidate for having dementia, not Alzheimer's. So Alzheimer's is the disease that people get. Dementia is not a disease. Dementia is caused by damage to the brain, and that's the difference between the two. I would like to ask, in terms of memory loss, well, let me make it clear. Sometimes, we have memory loss, and it does not, when I say memory loss does not refer to the fact that, okay, I have my AirPods here, and I put them down and I walked away, and then I come back and it's like, damn, where the hell did I put that down? And then I can't remember, but then I juggle my memory and I'm able to find it. That's normal memory loss. When we experience that, that does not mean that you have dementia. It does not mean that you have Alzheimer's. You can tell clearly when you're having those things. It's like when you're trying to, from what I've observed with my cousin, if you ask her, what did you have for breakfast this morning? She stops and you can see she's searching for the answer. And she does all of this and she's looking and she says, I don't remember. I said, you don't remember you had eggs and toast and a nice cup of tea with some baked beans and sausages? I don't remember. That is a memory loss that you have to be concerned about. And when you don't remember anything or you don't remember a particular thing, and you know you search hard to try and find the information, that's an area for you to look at and then to go and seek medical help. So I would like to invite the community to share if they've had any experience with anyone who has had dementia or who has had Alzheimer's, and what their experience has been like for them.
So while we wait for some hands to raise or something to be dropped in the chat, Charmaine, my grandmother was diagnosed with dementia. It wasn't called Alzheimer's, but the doctors told us it was dementia. And I can remember that she forgot things that always came naturally to her. She forgot how to make things that she had been making for 80 years. She no longer cooked because she would forget that the stove was on, and she burned herself a couple of times. So she absolutely had memory loss. And again, it wasn't described to us by the doctors as Alzheimer's. They just said it was dementia. And one thing that was never clear to me was this a result of her having aged? Because I don't recall there being any trauma to her brain. So I don't know if you can share, if you can share with the community the reasons or the causes for people to experience dementia, and if there is even a cause. But I do recall that from, seeing my grandmother many years ago.
In speaking with medical professionals, what I was told is that what causes dementia is just that damage to the brain. Like, you can be like, if you look at boxers and footballers that have that impact, and that involves impact on the brain, a lot of them end up, when they're much older, they end up with memory loss. So it's what impacts the brain. The doctors told me that one of the root causes are mini strokes, and mini strokes are not always visual. I was shocked to hear that my cousin had several mini strokes. I was like, several mini strokes. And one of them she had with me, and I didn't even know. There were no signs of this stroke. It was so small and so minute that I didn't even see it. Normally, when you see one that's having a stroke, you can tell either by the left hand can't move, or they have a slow speech, or they start drifting more to the left because they're losing mobility. I was really surprised and shocked to learn this, that and back in my day, well, not back in my day, but back in the Caribbean, one of the things they always label the elderly by saying is that, oh, she's just forgetful. Them old people, when they reach a certain age, they forget. That's old age thing, they're forgetful. They don't remember anything, and not realizing that the memory loss could either be the disease Alzheimer's, or they could have had mini strokes or diabetic, whatever comorbidity that you may have that was mentioned before, could aid in you having dementia. And we don't connect it. I would not have connected diabetes with dementia. I would not have connected mini strokes with dementia if I wasn't here with my cousin and being exposed to it. If we can get some other voices in that can share
Sure.
Mhm.
Jacqueline had her hand raised, so we can invite her to come off of mute, and then I can read some comments from the chat.
Mhm.
All
Good
right.
morning. Good morning. How are you?
Good morning.
Yeah, I have my mother. We're thinking she's starting to have little touches of dementia, but she's 2 years old. So some memory loss is normal. She's still able to recognize everybody. She doesn't always remember what she ate, but most of the time she does. But my neighbor and a very close friend of mine had parents who had Alzheimer's, and it was much different than dealing with somebody with dementia. These people would sometimes, like, it was almost like they woke up in the middle of being awake, and they would get very upset because they didn't recognize any faces there. They didn't recognize the place or anything like that. I had one lady run out of my house. She was here for an event, and she ran out of the house, and her daughter, who was the DJ, had to run after her. And then she was just very confused. And my neighbor, his mother, they watched her deteriorate before their eyes over a period of months, about a year or so, and she could never be left alone. Because she might walk out the house and leave, and she wouldn't know where to go, or what to do. And there has been cases of people with Alzheimer's who walked away and they found them dead somewhere because they didn't know how to get back. So I think that Alzheimer's, which is a disease, is much more devastating than dementia. I'm not exactly sure. Some of the stuff I've read has them linked closely together. They mention them in the same sentence as if they're the same thing. And I think that's very misleading. Even the Harvard Medical Journal does that, and I don't understand that, but that's my experience, and I'm complete.
Thank you, Jacqueline, for bringing that in, because that is so true, that they mirror each other so identically that one doctor can diagnose you as having dementia, and another one see you and tell you have Alzheimer's, and not really look at what's the core, what's the real root of that's causing this issue. Is it that this person has diabetes? Does this person have heart disease? Does this person has this person had several strokes? Well, let's look at that rather than just jumping the easiest thing. This person has Alzheimer's, and my cousin got two diagnoses: dementia and Alzheimer's. So which one is it? And from what I'm seeing, she has more dementia. She does not remember how to do basic motor skills. She does not remember how to, one day she went into the kitchen and she remembered to put the kettle on. She put the tea bag in the cup, but then she went to the toaster. She got 2 slices of bread. She put butter on the bed. She put the toaster down and she put the bread on top of it. She didn't remember that the bread has to go inside the slot of the toaster to toast it. She didn't remember not to put the butter, because that's electrical now. Butter running, oil running in an electrical appliance, that's dangerous. But she didn't remember those basic steps. And what she did, she recognized that she was forgetting, and she started placing around the walls 40 units of insulin, because she's also diabetic. She placed it everywhere. When I came here, everywhere on the wall had 40 units of insulin. But that was for her to remember to take her insulin. But in her not remembering, she didn't remember if she took it, and she didn't remember when she did not take it. And so what happened to her is she fell ill, and someone was here with her, and she told the person, "I'm not feeling well, I need my insulin." They didn't know any better. They thought, well, okay, she knows what she's saying. And she got the insulin, and that made her succumb to a diabetic coma, but because she could not remember if she took the insulin. Even today, if you ask her, well, like, she doesn't call me Charmaine, she calls me Terry. I remind her of her sister, someone that who has passed, has transitioned, but they had such a beautiful relationship when they were growing up. So she remembers long-term memory. She remembers things that happened way ago, but she does not remember what happens right here. Now, if I ask her, so who is Slim One? You. She can point and tell me that I'm Slim One. Slim One is the nickname that the family calls me. So she knows I'm Slim One. Well, what's my relationship to you? You're my cousin. I said, oh, okay, wonderful. Okay, Terry. And she goes right back into Terry. That information that I gave her, lost. She doesn't even remember in that moment. And it's such a sad thing to really experience. However, there are things that we can do to either slow that process down or what we can do now to make the brain healthy, which is what I would discuss on Wednesday. We'll have a part 2 on Wednesday. So the difference between dementia is usually caused by degeneration in the cerebral cortex, that piece in the back of the brain that I showed you in that diagram. That's what dementia, that's where dementia is affecting. That's that part of the brain that gets damaged that causes dementia. Alzheimer's is the most, and with Alzheimer's is the most common irreversible cause of dementia. So it falls under the dementia umbrella, but it's not dementia. It accounts for about 50 to 70% of all dementia cases. So Alzheimer's, the disease, causes dementia. Dementia by itself that is not caused by a disease is caused by comorbidities. Again, diabetes, strokes, heart disease, any type of injury to the brain that causes dementia. So essentially what they're saying is Alzheimer's disease, dementia was caused by something else, not the disease. That's the best way at looking at it and understanding it. If I can get to the, if I can get some more voices in this space as to their experience as well, or if, you know, what they've heard, what's coming up for them as we divulge in this topic.
Sure. So Charmaine, it's 7:25, and I'm going to share with you some of the comments in the chat, and then we have 2 hands raised. So we have Candace, who shares that her father's sister had Alzheimer's, but she had no direct contact. She did forget how to brush her teeth and how to eat and chew. Wendy shares she has normal memory loss and has to focus and search her mind, but eventually she remembers. She actually has an affirmation that she says, "Nothing is lost in the spirit," and intuitively it guides her to the lost object or the memory returns.
Ashe.
Z shared that her paternal grandfather had Alzheimer's. He thought my daughter was me, and as a result, he didn't know who I was, is what she shared. She goes on to say, "We were so close when I was young, it was very painful to be around him because she was a stranger to him." And then Terry says several of her neighbors had Alzheimer's. It was sad watching them deteriorate. They got lost and they had to be looked for. So those are the comments in the chat. Evelyn has her hand raised, and then Z also has her hand raised. So would you like to go to Evelyn and Z?
Yes, ma'am.
All right, Evelyn, would you like to unmute yourself?
Good morning, everyone.
Good morning, Evelyn.
Okay, I came in late, but I could relate because my mom was diagnosed with Lewy body dementia. And Lewy body dementia, basically, they're aggressive, they're very forgetful, and there's some other things I don't remember exactly. But what I could tell you in my experience with my mom for, like, say, the last year or so, she does not have diabetes. She had to get a pacemaker about 3-4 years ago, but she's healthy. And she gets aggressive with us. She's forgetful. She remembers things from when she was a little girl. She doesn't remember that my grandmother has passed. Like all her siblings, she has 2 siblings that passed. She doesn't remember they passed. She doesn't remember my grandmother passed. People that have transitioned, a lot of them she doesn't remember. And she was there, her brothers, her sister, but she doesn't remember. But she can tell you how she grew up on the farm and how her grandmother raised chickens and they had mangoes and avocado and all these other plantain. She could tell you that. She doesn't remember my sister. I have a younger sister. And when we're all together, it takes a while before she remembers who my sister is. So it's a very, very hard thing to watch. I try to like engage her with TV. I try to engage her with books. I got her some not the circle word books. It only keeps her attention span for maybe 10 minutes, and that's it. So it's watching someone that was very vibrant. Oh, and she's still, I be like, she on today. She always ready for argument or for a fight. But to watch the deterioration, and it's for us, it's mental, because she could still wash. She could still, only thing we don't have her do is cook. So I have a home attendant, and I make sure that there's always something in there for her to eat. But it's hard to watch. It's extremely, extremely hard to watch. And everything
It is.
Yeah, and as far as like, the illnesses, she's healthy. Only her mind.
But I'll say this, you said that she has a what? A pacemaker.
Oh,
So that's an indication that she has heart disease, right?
The reason why they put the pacemaker in, they never said she had heart disease. The reason why they put the pacemaker in is because her heart rate will race up and race down. So the pacemaker is there just to to keep it at a level. And since my mother used to, she didn't pass out, but she would always tell us she wasn't feeling good. She wasn't feeling good. And she couldn't explain to us exactly what was wrong with her. And we'd have to take her back and forth to the hospital, Since she's had the pacemaker, she's been fine. We haven't had to have so many trips to the hospital.
So let's explore that. We know that the heart, when it's pumping in its proper rate, that it carries oxygen to the brain.
Right.
So if it's pumping too fast, it's sending oxygen too quickly. If it's pumping too slow, it's not sending enough oxygen to the brain. And that starts to kill the cells, the memory cells. So dementia, like I said, what causes dementia itself, if it's not from the disease, what causes dementia is outside interferences that affect the brain. It could be brain injury, it could be heart disease, and all of that, the pacemaker, all of that falls underneath that umbrella. No, she may not have, her heart disease may be a stage 1, but it still falls underneath that umbrella because it's affecting the body. It's affecting oxygen going to the brain. And one of the things that they always look for is when someone passes out. That's the first thing they do. Like if they collapse, is oxygen going to the brain to make sure that it's not affecting any part of the brain, in particular that cerebellum in the back there. And if oxygen is not getting there, those cells die so quickly and they cannot rejuvenate them. But thank you so much for your share, and please, continue to be patient with your mom. Continue to do the word puzzles with her. Let her look at some current events, and just say, speak to her. And I always say this: speak to them in a normal way, because like you said, you just never know when it's on. Because they're sharp now. With all of that, they're very sharp. Very sharp. They give you some kind of answers. You're like, really? Okay. So you have to be so mindful of what you're saying. Don't speak to them as though they don't exist, or that, you're over here in this corner because you forget. No, still give them that dignity. Give them that dignity. Yeah, still treat them in a humanistic way. Treat them with love.
Yep. Thank you.
Thank you. You're welcome. Thank you so much for your contribution. Zakia, have a beautiful day.
You too, honey.
Yes, and be safe while you're driving.
Yes, I am. Thanks.
You're welcome.
Greetings, family. So I basically shared my experience with my grandfather. He pretty much forgot who I was. Well, he didn't forget who I was. He just thought my daughter was me. And so therefore, he couldn't figure out who I actually was. My grandmother, I don't think it was, in fact, I'm pretty sure it wasn't Alzheimer's, because she remembered most things, but she spent a lot of time in her past. So it was actually a good thing for me because I got a lot of family history when I was able to go visit with her. They both lived in Bermuda, especially the latter part of their lives. So whenever I got a chance to go and visit, I would just sit and just let her talk. And I learned a lot of things about her mother, a little bit about her father, siblings that she had, and, you know, because she spent a lot of time in her mind there. So she talked about that a lot. But she knew clearly who everybody was. She never had a problem with remembering who anybody was or anything like that. She would repeat herself a lot, which from my experience is a form of dementia, not so much Alzheimer's, the severity of Alzheimer's. But I've been around people who have these challenges, and it is very difficult to be around them. You want to help, but there's nothing you can really do, you know, except just be there for them, you know. So
Thank you so much for sharing it. That is so true. That is a sad thing to say because you really can't do anything. And I won't say you can't do anything for them. We can't control the progression somewhat. There's medication there, but it all depends on, does this person have kidney disease? What's their functions like? Do they have issues with the liver? So it all depends on what's going on with the body itself for a doctor to, or a neurologist to prescribe anything for dementia. But there are things that we can do. We can give them a nice, loving, warm environment. We can keep speaking to them as though they are still here in this present, in this current time, and be patient with them. Be very patient with them. It is difficult to sit back and watch, but what I've learned in this experience, working with being with my cousin, because I'm here with her 24/7, is to have more respect for anyone, not just the elderly, but anyone that may be experiencing either Alzheimer's or dementia. And like I said, they so mirror each other that you have to be so careful with them, because with dementia patients, they walk out the door and they're very sneaky. They know, it's like the brain just knows when to do things in the right time. Like I was washing dishes and I remember seeing Margaret sitting on the chair, and I looked at her from my peripheral vision because I could see her. She got up and she walked towards the living room. I said, it's kind of quiet in here. So I looked out and I said, damn, she's not in the chair. So I said, and she walks very quiet. I said, what if she went to the bedroom? Let me go to the bedroom. No, Margaret. I opened the door, I looked down the hallway because she's got this long hallway and she can't walk too fast because now dementia is making her forget how to use her motor skills, how to walk properly. And so I looked down and said, well, she couldn't have gone too far. So someone told me to go around by the neighbor. And the door, if I open the door now, you hear the door. I'm in the kitchen and didn't hear it. And I can hear when the door opens, even if I'm washing dishes, and I leave it purposely like that so I can hear her if she decides to walk up. But she opened that door so quietly and went to the neighbor's house around the corner and told, not outside of the building, in the building, she went to her girlfriend, Connie, and she told Connie said, does Charmaine know you here? She said, who's Charmaine? Terry. Does Terry know you here? Yeah, I told Terry I was coming. I went on over there. I said, Ms. Jones, what are you doing over here? Here's the answer. What is it to you? I said, well, what it is to me is that I just want to make sure that you're safe. Because once she came to me with that energy, I couldn't come back to her on that level. I couldn't be combative because that would have been a very combative situation. So I had to take it down. As hot as I was, I had to take it down. And then just say, okay, are you ready to come over? No, I'm not. I said, well, all right, so this is what we do. In the future, when you do want to go, just let me know. It's okay, I'll walk with you because I don't want anything to happen. I don't want you to fall. I just want to make sure that you get over to your girlfriend's house safely. Okay, I'm ready to leave now. And then we came back in. But it's a frightening experience. So you always have to be on your P's and Q's with them all the time. If you're living in a house together with them, your sleep pattern changes because you have to sleep very lightly to hear them because you just never know, especially if they're mobile, when they can get up and just walk. Sometimes they think day is night and night is day. Nighttime they going in back in the, I'm getting ready to go to work. Like, you don't work anymore. You retired years ago. You don't remember going to your retirement party, and it's just saying things that kind of like help them to juggle. And so I offer to everyone who either you know someone personally or you know someone not so personally, just, to be patient. If you see something, like, yeah, if you see something that's shifting in an elderly person that is not normal, the normal way of being, take them to the doctor, let them get checked out, let them get seen, and then take it from there. And I see Stacy has her hand raised, and so I'll take this last comment or question or contribution towards the discussion, and then we'll wrap up.
Grand Rising, sister. Okay, so first I'm just going to take a breath with you, everybody. We could take a breath with Charmaine. Yeah. And that's a breath for everyone who has a family member, anyone who dealing with anything like mental just challenges. And I just wanted to, and I'm like becoming overwhelmed right now with so much emotions. I just want to thank you, Charmaine, for who you are for Margaret. Like, it's such a blessing to watch you with her. Like I will have yoga sessions with Charmaine, and through those sessions, I'm already used that Margaret is a part of the session. That's automatic, and she'll be in her chair. And I'm like, Margaret, you over there? Like, good morning, Margaret. And she's like, good morning. Good morning. How you doing this? I'm good, Stacy. Like, I'm good. So, and it's just amazing the brain when I think about how amazing the brain is, like, what they can remember, what they don't remember. When she's in one instant, just like, okay, well, I'm gonna go to the vet. Oh yeah, well, some things it's like, oh wow, they wouldn't remember that, but then she gets it back. And it's just amazing. And all of the different things that caretakers deal with and that they're there for. And even when I saw the topic this morning, when I got on, I was like, wow, and tomorrow I'll be discussing even special needs and autism. Like, there's no coincidence like this week, but we'll be tapping into it. It always ends up flowing like that energetically. But I just want to thank you for who you are, and what Margaret has brought into your life, because what it is that it's taking you to the next level, even in your transformation for like what you're creating for the world, what you're creating for the planet, what God has placed in you, because of her being like, even if she could have been the seed for whatever else that's growing. So just thank you for sharing. Thank you so much. I love you. And thank everybody here and sending love and prayers. And I know that there's some things that I will find out, because I know that a lot of that energetically, like different things that Alzheimer's and dementia patients can do, like energetically for their aura, their chakras, their whole neurological system. So those are some things that now I'm going to just look into, and also place that in community or in the Wake Up Everybody family, so that sharing is caring, that we can give knowledge to one another. So thank you. Thank you so much for having this discussion today.
Thank you so much, Stacy. Thank you so much. And like Stacy said, she she knows Margaret. And she hears some things, like, Margaret, can you lift your leg? I did already, and this time she hasn't even lifted it, but it's all good. It's that energy that through yoga and through the pranic healing that Margaret is getting, and it works. It really keeps her calm when she can be very antsy. So in wrapping up about the brain again it's the master. It controls everything that we do, our hands, our speech, everything it does. And when we're looking at whether young or the elderly, all across the board, let's just have a little more compassion. Let's do what we can for ourselves to slow the process down or to even try whatever we can to prevent it. And so I thank you so much for giving me generously all this time for us to be able to talk and share what we know about Alzheimer's, what we know about dementia, how it impacts us, and what we can do for each other. And as in closing, if this impacts you, please take care of yourself, take a breath, take a walk, use the tools that we have over these past days, and let that support you and nurture you as you go throughout your day. Because it is a kind of a heavy topic that we divulged in. And I'm complete.
Thank you, Charmaine. Thank you for sharing. Would you like me to show anything in specific before we move to your special offer?
No.
Okay.
We can move to the special offer.
Okay, great. While I pull that up, you can share your special offer with the community.
Beautiful. All right. So my special offer today is the lucky person is going to win a $25 gift certificate to Bath and Body Works. A little pampering, buy some lotion. And they do have for men as well in case Adam wins it. So Bath and Body Works caters for everybody. It's not just for women. And so that winner will receive that $25 gift certificate. Look out for it in your email. But here's the catch. You got to respond by midnight tonight to receive the offer. If no one responds by midnight, then the offer is off the table. So whoever's the lucky winner, please respond to me through my email. That's the best way. And I will correspond to you through email. Look out for that $25 gift certificate.
Yes, and Charmaine, I have a winner for you. You picked number 22, and that is Zakia.
Oh, wonderful. Congratulations, Zakia. So again, reach out to me, and the next slide will show how you do that. Just take a screenshot of the next slide.
Thank you, thank you, thank you.
All right, so this is how you reach me. You can reach me by phone 404-271-5617, and also my email. My email is better, and if if you need to reach me more immediately after this, and you just feel like you need to share some more, that's fine. Call me. Don't text me. I am horrible at responding to text messages, but call me. I will answer that phone. As you see, I'm always walking around with this earpiece in, so call me. And for Zakia, who won today, congratulations and thank you for accepting. Go ahead and email me at charmainewewu@gmail.com. And coming up next, oh my gosh, Stacy McLean, Yogisha herself, will join us tomorrow, Tuesday, May 18th, where we're going to divulge in manifesting an ETA for your ETA, the Autism Special Needs Edition. And then on Wednesday, yours truly, again, me, Charmaine, will be here to divulge more on Health on the Brain Part 2. Beautiful. And the Wake Up Everybody Nation, we welcome all new members. Facebook, if it's your first time, if it's your first week, please drop that in the Facebook chat so we know that you're here. We would love to acknowledge you.
Community, if you are new to WOO, if you are new to us here at the Wake Up Everybody community, please share in the chat your name. Even tell us where you're coming from or watching or listening from. We just want to take this opportunity to say thank you for joining us. Thank you for being here and sharing space, sharing your energy with us as we continue to learn, elevate, and ascend. Invite others to join our community so that we can all learn, elevate, and ascend. Okay, I'm trying to advance the slide. Here we go. Here is our schedule. So if you are new, we are in the space Sunday through Thursday. Our 90-minute sessions are Sunday, Tuesday, and Thursday. And then our 30-minute sessions are on Monday and Wednesday. All 5 days, we begin at 7 o'clock. We're here in the Zoom room, and we also stream live on Facebook. So you can participate in either way. We have Woo Nation swag. This was co-created by members of the community in honor of our anniversary back in March, but we still have swag. So please, if you'd like to get your Woo t-shirts, sweatshirts, mugs, face mask, you can shop at bit.ly/Woo swag. And then finally, community, keep in touch. These are the ways that you can keep in touch with us. Register so that you get the information and the reminders for the daily sessions. You can keep in touch and communicate with us on Facebook. We have an Instagram page and a YouTube channel. And then we have email for those that may want to ask a question, offer a suggestion, provide feedback, or show some verbal appreciation. These are the ways to do so. You can screenshot this page. It will be in the chat as well. Please keep in touch. At this time, we're going to take down the slides and we're going to put everyone in gallery view so that we can share our love with our facilitator for today, Ms. Charmaine Callender-Nottingham. Thank you so much, sis, for the information that you have shared with the community. It is valuable and we appreciate you.
Yes,
So,
we
community,
love
let's
you.
shower.
Thank you,
Charmaine,
Charmaine, we love
Thank you for
you.
bringing us this.
Thank you,
Thank you for the
Soror.
show,
yourself.
Margaret. Thank you.
Can't do it without you,
Thank
Coach. Can't do it without you.
Thank
Amazing
you,
Grand
thank
Rising.
you, thank you,
Thank you
John.
for the
Thank you,
information. That was so
Naja.
powerful.
Thank
Necessary to
you.
know.
This was
Thank
so
you.
awesome. Thank you, thank you. Let's keep on
So
learning,
blessed.
sharing,
Never know when
growing,
we'll have to deal with those issues. So
even
thank
through
you.
the pain. Thank you.
Sister Coach Charmaine.
Can't do it without you.
Peace and love. And I'm
Peace and love.
Peace and love.
everyone have a beautiful day. Congratulations, Z.
Yes, congratulations. Thank you for keeping me in the spirit of gratitude. Thank you.
Thank you. Have a great